Will be protocols in place, but the fact remains at this point, while the international flights that many had wanted to resume in full operations will start from December 15th, but the COVID pandemic refuses to go. Scientists have now sounded an alarm over the super mutant COVID strain. It is now being called worst ever mutation that is said to have been detected in South Africa, and it could even make vaccines 40% less effective, is what the scientists researching the COVID strains are saying. And India also has flagged concerns over the new variant. The question is then, is the worst not yet over even now for COVID-19 around us? Take a look at this story.
It is not over yet. A new variant of COVID-19 is here. A worried South African government announced this on November 25th. The B.1.1.529 is the latest in the family of variants, causing a spike in cases in South Africa. So what is the new variant all about? The new variant detected has high number of mutations, 32 mutations. Director of the UCL Genetics Institute in London, Franco Boulay, reportedly hinted in a press release that the new variant could have evolved during chronic infection in an immunocompromised person, possibly an untreated HIV or AIDS patient. It can be detected with one particular type of PCR test.
B.1.1.529. So this is a variant that has been detected and reported to us from our colleagues in South Africa. There are fewer than 100 full genome sequences that are available. We don't know very much about this yet. What we do know is that this variant has a large number of mutations. And the concern is that when you have so many mutations, it can have an impact on how the virus behaves. So right now, researchers are getting together to understand where these mutations are in the spike protein and the furin cleavage site, and what that potentially may mean for our diagnostics, our therapeutics, and our vaccines.
About 100 cases of B.1.1.529 have been found in South Africa, most in Gauteng province in South Africa. The variant has spread from South Africa to Botswana, all the way till Hong Kong. 6 cases have been reported in South Africa, 3 in Botswana and 1 in Hong Kong. International governments have sounded alarm bells. A temporary flight ban will be in the place, and all travellers who have been in these countries must quarantine and take tests, said the UK Travel Advisory. The UK government has put South Africa, Botswana, Eswatini, Lesotho, Namibia and Zimbabwe back on the red list of countries for international travel on November 26th. India has also sounded an alert. The Union Health Minister has dashed off a letter asking all states and union territories to subject all international travellers entering India from at-risk countries to rigorous screening and testing. The WHO has designated 4 variants of COVID-19 as variants of concern: Alpha or the UK variant, Beta or the South African variant, Gamma or the Brazil variant, and Delta or the India variant. An emergency meeting called by the World Health Organization will decide the fate of the super variant and if countries must do more to restrict the spread of this new super variant.
At the moment, the Indian government has not resorted to imposing an international travel ban on countries like South Africa and Botswana. But sources in the government have informed that India is already operating within air bubbles with various countries. The message is now clear that international traveling and passengers will be screened rigorously, and their samples will be collected for genome sequencing at entry points, because a new variant is out to create havoc. With Pavan Kumar in New Delhi, Milan Sharma for India Today.
So what is this B11529? Let me help you understand why this is now again being highlighted. 32 mutations have been detected in the new variant, and therefore how did that really happen? According to the scientists, it possibly evolved through a chronic infection and also then evolved in most likely immunocompromised individuals. And therefore, what happens if one does catch it? It can be detected only with one particular test that will have to be done. So this is about what is B11529. What about these new mutant strains that have also come up? Take a look at this, and this is about global situation. The new super mutant strain is spreading rapidly globally. Take a look at these countries which have reported the infections. South Africa currently leading with 77 cases, Botswana with 4 cases, Hong Kong for now just has 1 case, but Israel also has sounded an alarm with 2 suspected cases of the worst ever strain, as the scientists are calling it, spreading globally within different nations. And the impact of this, it was a bloodbath on the Dalal Street today. The Sensex plummeted to 1,688 points in trade. Nifty lost over 510 points to close at about 17,026. Now, this plunge was the steepest in 7 months and erased 7.5 lakh crore rupees in wealth from the stock market. Now, the markets were spooked basically by the fear of a new, more virulent variant of the COVID-19 virus that has been lately discovered in southern Africa. World Health Organization has said that the coronavirus has a very unusual constellation of mutations and has warned against travel to some of these countries. This, of course, has coupled with the rising COVID cases already in Europe, leading to again lockdowns in several nations, and all of this has hit the market sentiment hard. Foreign investors sold off shares worth 2,300 crore rupees, and the so-called lockdown shares, as it is called, of some companies in sectors like banks, automobile, travel, hotels, metals also slumped, while pharmacy, healthcare and the FMCG stocks saw renewed buying. Now, remember, Europe is also being discussed because Europe is in the middle of a new COVID-19 crisis. Several countries again imposing restrictions in the European Union. Infections are higher than ever, and this accounts for 3 in every 5 new coronavirus cases across the globe. Now, the World Organization's fear is that there could be as many as 500,000 deaths, more deaths, by February 2022. Take a look at what the global status of COVID-19 is.
The COVID pandemic is far from over. In fact, it's rising with vengeance across Europe.
Probably by the end of this winter, pretty much everyone in Germany, it has sometimes been said, somewhat cynically, will have been vaccinated, recovered or died. But it's true. With the highly contagious Delta variant, this is very, very likely.
COVID restrictions are returning. In Germany, it's nearly 9 million people who are not allowed to leave home except to go to work or shop for essentials. Austria has announced a complete lockdown from the 22nd of November. It is the first European country to declare compulsory vaccinations from February 2022. Hungary, Belgium and Netherlands are also mulling shutdowns as the virus rages. On the 8th of November last year, Europe reported the peak of the year with 2.87 lakh new cases, which went down to around 40,000 on June 19, 2021. On the 21st of November 2021, new cases jumped again to 3.3 lakh, almost 61% of the world's new cases. Germany surpassed the United Kingdom in terms of daily deaths, and the gap is only widening. Germany now reports over 200 daily deaths. The crisis in Russia is deadlier, with the country reporting more than 1,200 deaths every single day, in spite of a decline in new cases. Germany had only 8,000 new cases on the 1st of October, but on the 21st of November, the number jumped 6 times to 49,206. It was almost the same story in the UK, in Russia, Netherlands, Australia and Italy. So what's really causing the surge? Is it waning immunity or vaccine resistance?
It is winter time. When people gather indoors for festivities, the surge is expected to get worse. When a large number of individuals have infection in the community, there will be a proportional rise in the number of hospital admissions. Therefore, the hospital systems are being strained and lockdown has already been instituted in certain regions.
The World Health Organization is worried. It fears there could be as many as 500,000 more deaths by February. Deaths are being seen even in highly vaccinated countries.
COVID-19 is surging in countries with lower vaccination rates in Eastern Europe, but also in countries with some of the world's highest vaccination rates in Western Europe. It's another reminder, as we have said again and again, that vaccines do not replace the need for other precautions. Vaccines reduce the risk of hospitalization, severe disease and death, but they do not fully prevent transmission.
India too is concerned given the opening up of international travel and a sudden rush to make full use of it.
This is definitely a time where the guard cannot be lowered. This is definitely also the time when the panic should not set in, the fear should not be set in. We should move in this phase with responsibility. Responsibility in terms of the COVID-appropriate behavior, which is still relevant. Responsibility to ensure that the adults are vaccinated. And responsibility on the part of the government to ensure that the surveillance, genomic surveillance and the preparedness is not diluted at all.
India is taking solace from the fact that 99% of COVID cases are courtesy the Delta variant that ravaged India in the summer of 2021. The same variant was first detected in India. That there is immunity to this variant given the widespread exposure and no other variant or lineage has so far been more dominant is what is making India more hopeful. In New Delhi with Milan Sharma, Sneha Mordani for India Today.